Every day, millions of people walk around with dangerously high blood pressure without knowing it. That's why doctors often call it the silent killer. But here's something many people don't realize. Although high blood pressure often has no symptoms, your body can sometimes give you warning signs before serious complications happen. Ignoring these signs could lead to a heart attack, stroke, kidney failure, or even permanent vision loss. In today's video, I'll show you 6 warning signs of high blood pressure you should never ignore, explain why they happen, and tell you when it's time to seek medical attention. Make sure you stay until the end. Welcome to Health Explained. Here we simplify medical information, teach disease prevention, explain warning signs, and help you know when to seek medical care before a condition becomes serious. If you enjoy learning practical health information, consider subscribing and turning on notifications so you don't miss our future videos. Before we begin, let's understand what high blood pressure actually is. Blood pressure is the force of blood pushing against the walls of your arteries every time your heart beats. When this pressure stays consistently too high, your heart must work harder to pump blood throughout your body. Over time, this extra pressure damages your blood vessels and increases the risk of stroke, heart disease, kidney disease, vision problems, heart failure. A normal blood pressure is usually below 120 over 80 millimeters of mercury, often written as 120 over 80 millimeters of mercury. Blood pressure is generally considered high when repeated measurements are 140 over 90 millimeters of mercury or higher in many healthcare settings, though some guidelines use 130 over 80 millimeters of mercury as the threshold for hypertension in certain adults. Most people feel perfectly healthy, which is why regular blood pressure checks are so important. Warning sign 1. Severe headache. A sudden severe headache can sometimes be a warning sign of dangerously high blood pressure. This usually happens only when blood pressure becomes extremely elevated, a situation called a hypertensive crisis. The headache may be intense, feel different from your usual headaches, and sudden. If a severe headache is accompanied by chest pain, vision changes, weakness, confusion, or difficulty speaking, seek emergency medical care immediately. Warning sign 2. Blurred vision. Your eyes contain tiny blood vessels that can be damaged by high blood pressure. As these vessels become injured, you may notice blurred vision, double vision, difficulty focusing, temporary vision loss. Persistent high blood pressure can permanently damage the retina if left untreated. Warning sign 3. Chest pain. Chest pain should never be ignored. Although chest pain doesn't always mean high blood pressure, it can occur when elevated blood pressure places extra strain on the heart. Chest pain may signal reduced blood flow to the heart attack, and aortic problems. If chest pain is severe, especially with shortness of breath, sweating, nausea, or pain spreading to the arm or jaw, seek emergency care immediately. Warning sign 4. Dizziness. Feeling dizzy isn't a common symptom of routine high blood pressure, but it can happen in serious situations or due to complications. Dizziness can also result from many other conditions, such as dehydration, inner ear disorders, or low blood pressure. If dizziness is sudden or occurs with weakness, numbness, difficulty speaking, or loss of balance, seek emergency medical care because these may be signs of a stroke. Warning sign 5. Fatigue and confusion. Severe high blood pressure can affect blood flow to the brain. Warning signs include confusion, difficulty concentrating, extreme fatigue, and trouble thinking clearly. These symptoms require immediate medical assessment. Warning sign 6. Facial weakness, arm weakness, or difficulty speaking. This is the most serious warning sign on our list. High blood pressure is the leading modifiable risk factor for stroke. Remember the word FAST. F stands for face drooping, A for arm weakness, S for speech difficulty, and T for time to call emergency medical services immediately. Every minute matters during a stroke. Thank you for watching, stay healthy, and I'll see you in the next video.